Hello class, my name is Emily Corley. I'm a student physical therapist assistant at Jeff State. Today I'm going to be talking about Mycoplasma pneumonia for the Micro Teach assignment in PTA 240 Physical Disabilities 1. Okay, so Mycoplasma pneumonia is commonly known as atypical pneumonia. It is caused by the bacterium Mycoplasma pneumoniae, which the bacterium it has a rigid cell wall and it's very small. So it's hard to get rid of, and it will attach itself to the walls of the lung, which manifest into the pneumonia, and it will eventually lead to inflammation of the bronchioles and cause them to become swollen. All right, so this is spread through droplets in the air. So say someone coughs or sneezes and they're infected with this, so then those infected droplets are out in the air. You can walk through and breathe those in, and so then you might become infected that way. Also, poor hand hygiene. So if someone coughs in their hand and then they touch other things that you might also come in contact with, it can spread that way. So it's very important to wash your hands, to practice good hand hygiene, and cough and sneeze in your elbow or somewhere that it's not indirect with your hands or out in the open. Okay. So this is diagnosed by a medical doctor. If you start seeing symptoms such as cough, fever, shortness of breath, those are some telltale signs of Mycoplasma pneumonia, also known as MP. So once you see the doctor, they'll perform auscultation after taking vitals and all of that stuff. They'll perform auscultation to listen to your lungs and check your breathing. They also might request a chest x-ray to see any type of inflammation, how far along, or just to see whether it's maybe acute or chronic. They also are going to look at the past medical history, so that's very important for the medical doctor to look at before they make any type of diagnosis or prescribe any antibiotics. So the people affected, it really can be anyone. There's not a more specific gender or age that can get it, but it affects people that are infants or elderly a little bit harder. People with weakened immune systems, is definitely harder for them to get over this pneumonia and kind of be cured from it. So it's not a particular, like you or I, we can get infected with it, but we will probably typically start feeling better within a week or two at the latest. Someone who is elderly, maybe with history of lung cancer or any type of other issue, maybe a heart attack in the past, it might take them longer to get over this and to really get back to their full breathing and all of that. Same with children, who it just will take them a longer time to kind of heal from this. Okay, so the prognosis for this, for the patient, it's usually favorable. So you're going to be prescribed, for one, a round of antibiotics and rest and hydration from the doctor. So it's cured that way, typically, is you take your antibiotics and you rest and you hydrate, and this should kill the bacteria that is in there causing this. So it normally doesn't linger for longer than 2 weeks, but you can have a persistent cough for up to a month, just trying to get everything back to normal. So if someone is not getting better and say they start experiencing chest pains or coughing up blood or something more serious from this Mycoplasma pneumonia, they will most likely be admitted to the hospital. So the prognosis for these patients may start to decline rather than your otherwise normal healthy individual. So the type of antibiotics that are going to be prescribed, the most common one is erythromycin, but it's going to be very heavily dependent on the patient's past medical history, the different allergies they have, and just kind of works best for them. Okay, so although this disease doesn't typically disable someone for the remainder of their life, it can definitely cause temporary disablements. So your breathing will become impaired just from the inflammation and the swelling in the bronchioles. You just won't be able to breathe as much, which can lead to a lack of energy. And say you are so deprived of energy, you can't get out of bed hardly, you can't go to work, you can't fulfill those social obligations. So that's going to definitely limit you to what you are able to do during your daily life, which could lead to a very short disability while you're trying to get better and get over this disease. Now, whether it's just a couple of days, you're just stuck at home, you can't do anything, you have a high fever you're trying to fight, maybe not even able to shower for those few days you're not feeling well just because your energy is so low. It's most likely you're going to start feeling better, you're going to break the fever, be able to breathe better and get your energy back. So what you are disabled during the disease, you most likely will not be disabled after you are cured from it. Okay, so a patient that is in physical therapy for NP, they've probably had issues going on for a while now. If they're in the hospital due to pneumonia, they are experiencing severe shortness of breath. They are probably weak whenever they're trying to breathe. Their ventilatory muscles are very weak, so they cannot get a deep breath in and a deep breath out. So physical therapy is definitely indicated to help these patients learn how to do different breathing techniques, to do exercises to strengthen these muscles, exercises to stretch out the pectoral muscles so that they can open their chest some and be able to get a deeper breath in. Physical therapy is also going to be important to teach these patients how to break up mucus secretions that might be in their chest. So the physical therapist can perform percussions on the patient's back. Also, we can educate on postural drainage positions so that gravity can help kind of break up some of these secretions and help the patient cough them up. The patient might also need help learning how to have a productive cough. So with these patients, you want to take standard precautions. You might feel comfortable wearing a mask while treating them, and definitely wash your hands. You probably would not want to work with this person if they have a high fever and their white blood cell count is greater than, is less than 1,000 millimeters cubed. You don't want to exercise with that patient until they start feeling better and that fever breaks. So in physical therapy, you're going to expect to get your vitals taken. This is very crucial during the treatment so that the patient can stay healthy. And the patient, depending on their age and kind of their overall health, is going to depend a lot on the pace of their therapy treatment. So as I said before, it's going to be very important to educate this person on the disease and how to prevent it in the future, and how to perform home exercises to continue strengthening those muscles to help them breathe deeper and better, and also instruct them on how to perform a productive cough and what healthy and unhealthy sputum might look like. So if it's blood tinged, that's definitely unhealthy and they want to report it to their doctor. But it's very important to educate your patient on all of these aspects. Also, if your patient is not understanding this, it's important to get with the family members. So all of this means just try to stay healthy with yourself and eat a balanced diet and get sleep, and hopefully you will not have these issues. Thank you.